Nobody tells you these things might happen after you get an epidural. Everyone just talks about the pain relief. But today I want to go through some things that might happen after you have your epidural. In general, they are not anything that is a complication, and they aren't that scary, but they can feel scary when they're happening to you. So I'm so glad that you guys are here, because this is important information to have as you go towards your upcoming hospital birth. While we're here, have you gone through a birth plan to make your choices about what kind of pain management you're wanting, other choices that you're going to make at delivery? I have a whole series that's totally free. I'm going to link it down below about making your birth plan. And before we get going, I gotta say that I had a couple of these on my first baby, and I was really surprised by them. They didn't talk about them in my birth class, and I wasn't prepared for them. And so I'm really glad that you guys are here. And yes, these are things that I have seen after seeing thousands of patients who've gotten an epidural. So it's not just my experience. It's a lot of bedside labor and delivery nurse experience talking to you in this video. Okay, the first one is that your blood pressure may bottom right out after you have your epidural. The reality is that you have been very tense when you're in labor. Your whole body is tense, and then it very quickly relaxes, and your blood pressure can bottom out at that same point in time because everything relaxes. Now, prior to getting your epidural, we're most likely going to give you some extra fluids to help prevent this. And there are medications that we can give if this happens to you. We can resolve it very quickly. But I want you to know that it's happening. Some of the signs of your blood pressure dropping can be kind of a weird taste in your mouth. Your ears either ring or they feel different. That's what I had. My ears got very hot and there was sign of some ringing in them. Ultimately, I kind of felt like I was going to die. And the thing is, as a patient, you actually have those symptoms before we can even catch it with our blood pressure cuff, even though we're taking it very frequently. So making sure that you tell your nurse, especially right after you have your epidural, if you're feeling anything weird, so that she can help you faster rather than waiting for that next blood pressure check. You can feel better much quicker that way. Here's one that catches a lot of people off guard, and it is shaking. Now, it feels like you are cold. It's the same thing that you would shiver if you were cold. However, this is happening for a different reason. Honestly, we're not exactly sure why it's happening. Sometimes it's just that you're nervous. I am a nervous shaker. Like, I shook while I signed my mortgage papers. But it can also be the cold fluid that goes right next to your spinal column. It can just be the relaxing. That's kind of how your muscles are relaxing. There are things that we can do. We can get you a warm blanket. And even though you're not really cold, sometimes that warm blanket just helps you relax into things. There sometimes are medications that we can give if it's really bad. But one of my favorite tricks, because I don't like giving medications if I don't have to, is to stick your tongue out. Just like that. And I don't know why it works. Maybe it's just your brain like, please don't chew your tongue off. But a lot of times that will help the shaking. So you just kind of breathe with it out for a little bit. I got to tell you that the more you try and stop the shaking, the worse it gets. So the more you can relax into it, usually it gets better, and it does not in general last very long. But it can be really annoying after you get that epidural in. Now, you can actually get a small fever after you get the epidural. And it is most likely because we are infusing cool fluid right next to your spinal column. And so it is thinking we need to raise this temperature because we are cold, even though all of the rest of your body says that you're a fine, normal temperature. Now, this should not be an actual fever. We don't call a fever until 100.4, but you can, get close to that just because of those things. So it's something that's important to know. Again, it's not a problem. If your fever were to go above 100.4, you would need to have, different interventions, and that is not from the epidural. But it's something to be aware of. Sometimes you have shivers or shakes like you have a fever, and that's just something to be aware of. I would still bring up those symptoms to your nurse so they can check your fever and make sure that fever is not an issue for you, because it can be a problem during labor. Now, another one a lot of people get is actually nausea and vomiting after they have the epidural. Some of that can be from that blood pressure drop. So when we resolve that, it fixes the nausea and vomiting. I know that happened for me. Some people really just don't react well to the medications. The good news is we have doctor's orders where we can give you something for it. So if you are feeling nauseous, if you are throwing up, please call your nurse, let her know so that she can get you those medications. Usually it's a Zofran or a Phenergan that can help calm down your stomach and help you to relax. My favorite thing to do after an epidural is to get a good nap. So if you are throwing up during that time frame, I want to try and fix it as much as I possibly can, because I want you to get that awesome nap and fill up your gas tank for the rest of labor. Side note, most often, if you have an epidural infusing, they are only going to give you clear liquids on your diet order. It's not a time that you should be eating a lot. That being said, most people do not want to eat a whole lot. They want to rest. And then hopefully once they get their rest in, they can have their baby soon. If you are absolutely starving with an epidural in, talk with your healthcare team about the choice that is right for you. Another thing a lot of people get is itching. They get super, super itchy, and that is their body reacting to the medications. Sometimes we can give you Benadryl or other medications to help counteract that, but it does make you sleepy. Again, could be great for that initial period where you want to take your nap. However, if you're getting close to delivery, you might not want to have Benadryl on board as well. So it might be something that you just kind of need to tolerate. One of my favorite things to do as a nurse is to give you one of our dry washcloths. Our laundry tends to make everything a little bit scratchy, but using the dry washcloth to itch is a lot better than actually using your fingernails. So that's one of my favorite things to do. Sometimes I give them a dry and a wet because it can feel better if you wash I think that's all in our mind, but whatever we can do to help with the itching, we want to help you out with. And again, if it's driving you absolutely crazy, be sure and let your nurse know because there might be something that we can give you. Now, this is something that not a lot of people talk about, but some people really don't like how numb they feel after they've gotten the epidural. I know you signed up to not feel anything with pain, but they're just like, I can't even move. I can't feel anything. And so again, I'm a big fan of that in those early times where you're getting your nap in. But did you know that we, as your healthcare team, can turn up the epidural if you're feeling too much, but we can also turn down the epidural if you're feeling too numb. So talk with your healthcare team. If you're just feeling too numb, they can turn it down and can help you be at a more comfortable level. I think a lot of people don't know that you can really tailor the epidural to your needs, and we can move it up, we can move it down. It goes in with the epidural pump, and so we can tailor it to what you want. I hear a lot of people asking for a walking epidural, but a walking epidural is really just a very light epidural, and it may not be enough to cover the amount of pain that you want it to cover. So, you can move that epidural up and down as you want. It can be adjusted very easily. Talk with your healthcare team. Now, in this video, I'm not going over all of the risks that they're going to go over with you before they give you the epidural. It's called an informed consent, and your anesthesiologist will come in the room and do that with you. Unfortunately, you're in a lot of pain at that time, and most people are like, whatever, just give me the epidural at that point. So you can have that discussion with your OB in the office about things that could happen with the epidural so that you can really truly have an informed consent. Your OB knows the basics. And one of those can be a spinal headache if they were to go too far into the epidural space. So talk with your provider so that you know some of the risks. What I've talked about here is mostly side effects of the epidural. Now, everyone seems to think that back pain is a side effect of getting the epidural. But fun fact, we actually give epidurals to people who have severe back pain, usually older than the people that are having babies, to help with back pain. So if one of the things from an epidural was that it caused back pain, we probably wouldn't be giving them the epidural to prevent back pain. And studies actually show, nobody wants to agree with this, but people who get an epidural versus people who did not get an epidural, the people who got the epidural do not have more back pain than those who did not get the epidural. I'm here to remind you that your body is doing so much work with something that is entirely changing your center of gravity. It really makes your back and your core work during pregnancy. Then you go and you push out the baby, and then you go and you're carrying this freakishly heavy car seat. Pregnancy, labor, birth, having a baby, living with a baby, taking care of a baby is so much on our bodies. If you find that you're having back pain after your delivery, talk with your provider, maybe get a referral to a great physical therapist that can help you manage your back pain, build back up that core, and really do it better. I actually have a core video that I recommend postpartum. I'm going to link that one down below. It's called the Mommy Tummy Fix. I am actually doing it even though my baby is 16 years old, and I found it very helpful for rebuilding that core. Pregnancy is tough on our bodies. We need to know that going into all of this. Now, these aren't the only things that can happen with an epidural. It is possible that your epidural might not work. And I actually have a whole video about it that I'm going to post up above. Have you heard of any of these side effects before? Tell us down below if you have heard of them or if you experienced them on one of your pregnancies. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and your epidural.